Alright, welcome everybody. Thank you for tuning in. Today we're going to be talking about medical myths regarding lower back pain. Now before I begin, I think you should know that these points were inspired by the article titled Back to Basics, which was authored by Peter O Sullivan, published in the British Journal of Sports Medicine. It's a very quick, insightful article, very interesting, so if that interests you, please check it out. I'll leave a link in the description below to where you can find it. Regardless, let's just jump into it. Number 1, lower back pain is a serious medical condition. So many people have very fearful beliefs regarding lower back pain. But if you don't present with any red flags or any serious pathology, then what we're left with is a condition that is seriously painful, but not medically serious or life-threatening. Now, when I use terms like red flags and serious pathology, I'm referring to diagnoses that include things like tumors, spinal fractures, infections, really sinister conditions. But these are only found in like 1% of cases of lower back pain. In 90 to 95% of cases, there is very little suspicion of something dangerous happening. Your lower back is strong as all hell, so there's no need to fear. Number 2, lower back pain will become persistent and deteriorate later in life. But research doesn't support this. Lower back pain occurs to anybody at any age. Most episodes will improve and do not get worse as we age. And in fact, evidence-based treatments can help and assist at any age. Number 3, persistent lower back pain is always related to tissue damage. Notice how I use the term always, because of course, in many cases, structure and your tissues will be involved, but not always in a damaging fashion, but maybe increased sensitivity and irritation. Nevertheless, lower back pain and pain in general is incredibly multifaceted and cannot become attributed to one single causative anatomical structure. We can't just make assumptive associations like your back pain is caused by weak glutes, piriformis irritation, uneven hips, sacroiliac joint dysfunction, leg length discrepancies, or narrowing disc space. It's almost impossible to rule in these factors as a single cause of lower back pain. And we see, especially in those with chronic lower back pain, which is back pain that persists for 6 months to 1 year or even longer, that the pain is related less and less to tissue damage, and it's more and more related to issues such as poor pain coping strategies and psychosocial factors. Moving on to number 4. Scans are needed to detect the cause of lower back pain. No! Scans rarely show the cause of lower back pain. Like I said, if serious pathology is ruled out, it's very difficult to identify the cause of lower back pain. There are so many studies that have done investigations on pain-free populations that show some sort of pathology, especially in older individuals, but also in young adults. A large percentage of us will show some type of pathology like disc bulges, disc protrusions, narrowing disc space on an X-ray or an MRI, even though we're completely pain-free and we don't have any problems at all, up to something like 80% of the general population. So it's difficult to say that that's the cause of pain. At the same time, only like 3 to 5% of lower back pain cases have these disc involvement or nerve root type issues. 90 to 95% of cases, yet again, are non-specific. So scans only assist in a minority of people. We know from the literature that they can't determine prognosis, they can't determine disability, and they don't improve outcomes. Meaning that individuals with lower back pain that are managed according to their presentation on a scan compared to individuals that are managed without any scans or investigations tend to improve to the same degree. So in many cases, scans are not needed to tailor management to your specific case. In fact, scans can actually be potentially harmful. If you have some type of pathology that suddenly comes up on a scan, it's going to make you psychologically worried, even though we know that it isn't a predictor for disability or pain. If you go in for a scan and nothing comes up, yet again, it may cause you some degree of psychological stress because people like understanding and figuring out what is wrong with them. And if they can't figure out what is causing what they're experiencing, and if nothing is there, then that obviously is going to piss them off. Anyway, so the last myth. Treatments such as strong medications, injections, and surgery are effective and necessary for treating lower back pain. The fact is, effective care for lower back pain is relatively cheap and safe. In most cases, lower back pain can be managed completely conservatively. No need for surgery, no injections, maybe some forms of moderate medication depending on the case and the person, but these treatments usually aren't effective for persistent lower back pain in the long term. In trials that compare surgery to non-surgical management with physiotherapy, the outcome at the longer time frames tend to be the same, about 1 to 2 years later. So if you think about it, are the associated risks and side effects that come with having surgery, the bed rest, the trauma, the anesthetic, the healing, the cost, the risk of infection, really worth dealing with if conservative treatment gives the same benefits 1 to 2 years later down the line? Finding low-risk ways to control your pain are key, like guided and graded rehabilitation. But also, I don't mean to tout my profession as a physiotherapist. Sometimes it may not even be necessary to receive treatment from a clinician. If you are knowledgeable enough about the condition to manage it alone and are able to return to graded, meaningful activity by your own accord, then by all means, go for it. So, in conclusion, unhelpful lower back pain beliefs are common, culturally endorsed, and not supported by evidence. A positive mindset regarding lower back pain is associated with lower levels of pain, disability, and healthcare seeking. Lower back pain is literally the most common musculoskeletal complaint in the world, and it is very unlikely that you will go through life without having at least one incidence of lower back pain. So being educated and mindful of these factors that I've mentioned is very important in a public health sense, so people can realize that these things happen and that they are normal. That's that. Thanks for watching. If you find these informative slides interesting, I post all of them down on my Instagram. Go check it out. And please do not hesitate to leave me a comment for any ideas, questions, concerns, and the whole lot. I appreciate the support. This is Wernli K, and I'll check you next time. Peace!